Well, now that we understand more about soft tissue dysfunction, let's look at how it applies to treatment of cases. Here's a very good example of a very extreme case, what we're talking about in terms of growth and development. This boy was brought to me because no one else would treat him. He obviously has a severe malocclusion, and I like to say to doctors, is this a crowding case? Are these teeth too big for the jaws? Would you extract in this case? And the problem the child has is its poor growth and development. So it's malocclusion. Is it genetics? Well, he had a twin brother, which I'll show you, and he didn't have a malocclusion. Is it big teeth in small jaws? Or is it just poor facial development, which may be genetic? In addition, this child had allergies, had mouth breathing issues. Obviously, poor speech and eating problems relate to this very large overjet and very narrow maxilla. This is his twin brother. You can see they look totally different. This is a bit of a reverse of the twin studies. So I decided to treat this child with my system, which is my system, and trainer, a MyoBrace. And the main emphasis of the treatment was, let's not worry about the teeth, let's get the correct arch form that gets the tongue up into the maxilla and get the child functioning correctly and see what happens. So we use upper and lower bent wire system. We, in conjunction with the trainer, we followed by the MyoBrace, and you can see very gently the arch form is improving, bones going with it, but really all we're doing is correcting function. It's not so much an emphasis on perfect tooth alignment. We really want to get correct function. The MyoBrace comes in at the end to get improved in alignment and better function. You can see now the child is breathing through his nose, he's looking healthier, and his craniofacial growth is catching up with his twin brother. Now they're starting to look a little bit the same. And you see, again, let's not emphasize too much about the dental alignment. We got him functioning correctly, put him on finished off with the T4A, and this is what I want to show you, an appliance system that really is not just putting something in and hoping something happens. It's really about treating the patient functionally and getting correct function, and then the dental alignment side is very easy. So no, the teeth weren't too big for the jaws. It was just poor myofunctional habits. We corrected the habits and we got space for the teeth. In our practice, we very rarely extract teeth. And the amazing thing is now that his growth and development is catching up, and now the children who are twins now look like twins. So we've brought in the correct growth and development and the genetic potential of this child. Now, that's what we do every day in the practice. We take away bad myofunctional habits. We allow the natural growth and development to perform normally. We're not making jaws grow. We're allowing children to grow naturally. So this is where we started, and this is where we finished. And I think you'd see that the mid-face development is majorly improved. And did the appliances do this? No, the appliances just helped the child correct his own habits. So here's another extreme case. I'm showing you more severe cases because many times doctors think that they use a trainer or a MyoBrace only on minor cases, and they use conventional orthodontics on the other more severe cases. And that's entirely incorrect. In our practice, we treat the most severe cases myofunctionally and we get great results, but we have to use a series of appliances, and I'll show you that when we come to the appliance section. Here we have I2N, which is really our standard appliance now in the advanced myofunctional orthodontic system, and the bent wire system. Not ideal age, an older patient, but you can see how we're getting good correction of the overbite and also improved arch form. And this is what it's all about. We don't worry about the teeth to start with. We just get the arch form sufficient so the tongue can fit up in there. Now, if we're talking about the younger children, we don't really need to do the arch expansion because we've got time for the tongue to do the arch expansion. But in the older children, you have to get in there with the bent wire system to expand the arch. And you can see now We started with an I2N with the bent wire system. Bent wire comes out, we go to an I2, myobrace, and then we finish with the T4A, which is our standard retainer, and we get the bite to settle, and pretty good result. Here's another more extreme case as well, completely blocked out canines. We see many of these in our practice. Blocked out canines, patients go and seek orthodontic treatment, and they've been told that they need to have extractions. And this is a case where the mother was a dental assistant and she didn't want extractions, probably left it a little too late, but this just shows you the power of the system. Again, bent wire system, I2N to start, and you can see the improvement in the arch form. Now we have a very simple orthodontic issue. We're able to get that canine slotted away into the correct space. But look at that lower anterior crowding, how it's been resolved really nicely, and there's been no appliance used on the lower. All we've done is correct function, and automatically the lower teeth are aligned. Of course, the myobrace does the final alignment for us, but this is an emphasis that very light forces with correction of function will align the lower anterior teeth. And we see this in many cases. Here's another case, a younger child, much better, much more ideal. We like to start in the early mixed dentition, but severe crowding, and her mother was told that it's okay, just wait 5 years and we'll extract a few teeth and align them. But you can see that her craniofacial growth is quite poor. You can see mouth open posture, reverse swallowing patterns, and that's what we went and corrected. We use a BioBlock upper in this case and improve the alignment, mostly using the I2 and followed up by the myobrace. But what's interesting here is the improvement in the mid-face development, and that's what I want you to see. Forget about the teeth for a moment. We always get more space for the teeth. Look how much this child's growth and development has improved. What we do with all children, we put them in front of a mirror and say, this is your problem, this is where the tongue should be, this is how you should be swallowing. We don't just rely on issuing them with the appliance, but we get down to the child's level and we make sure they understand it's their habits that need to be corrected. So here's where she started, quite severe, and here she is. You can see those lower anteriors, again, no treatment on the lower. They help to be aligned themselves by correcting function, and then we go in with a very simple BioBlock lower appliance to do the final alignment. The important thing to see here is they very much improve maxillary development, and that's the key, and getting the tongue up into the maxilla is the key to this treatment. And you can see now, very easy orthodontic issues that can be corrected. We just finished this case with the myobrace, and to learn more about the myofunctional orthodontic system and the appliances, it's quite complex, come to one of our courses.